The World Health Organization is the world's top advisor on health matters. It is proving to be the world's biggest disappointment too. The WHO guidelines are confusing, incoherent, and inconsistent. More than 400,000 lives have been lost so far, and all that the WHO can come up with are trial and error guidelines. The latest instance features the WHO's technical lead on the Wuhan virus outbreak. Her name is Maria van Kerkhove. On Monday, she said that asymptomatic patients do not transmit the virus, meaning that if you're not showing symptoms, you will not infect others. On Tuesday, she said that asymptomatic virus carriers can infect others. Listen to this.
So there were quite a lot of messages that I received overnight. It still appears to be rare that an asymptomatic individual actually transmits onward. What we really want to be focused on is following the symptomatic cases. I don't want to get too technical, but that we do know that some people who are asymptomatic or some people who don't have symptoms can transmit the virus on.
Now, just to clarify, asymptomatic carriers are those who are infected with the virus but do not show any symptoms. Some estimates say that nearly 40% of the global population is infected, but they're asymptomatic. The question is, can they infect others? No one can say for sure. Maria van Kerkhove says that she was referring to a small subset of studies. They do not present a complete picture, but enough to cause confusion. The world believes the World Health Organization is making statements based on scientific evidence. By now, the world should know better. And this is not a small slip. Here's what we need to understand. The world is easing restrictions. It's important to understand the risk of asymptomatic transmission. Should governments track asymptomatic cases? The WHO does not have an answer. And this is not the first time they've done a flip-flop on guidelines. Remember what the WHO had said about masks. First, it said that not everybody needs a mask. Then in the month of April, it said face masks cannot stop healthy people from contracting the virus. The WHO said that people should not wear face masks in public. Only those who were sick or caring for the sick needed a mask. The World Health Organization stuck to this line for over 2 months. Then on the 5th of June, it did a U-turn. 5 months and 7 million cases later, the WHO decided that everyone needs a mask. Everyone should wear a mask. The advice has come way too late. Thankfully, governments around the world did not wait for this advice. Long before the WHO figured it out, more than 50 countries had made face masks mandatory. In each of its briefings, the World Health Organization says that this is not the time to drop the guard. But throughout the pandemic, it has failed to help fortify the guard. Confusion in the middle of a pandemic threatens the global response. Remember, the virus is still spreading. We need a health body that is clear-headed, not one that compounds the misery.